Eastmond, who is chair of cell biology and neuroscience at UC Riverside. And he, as we've been discussing, took the straight science path to where he is now. He got his PhD at UC Berkeley in environmental health sciences, also working with the biomedical sciences program there. And he came to UC Riverside after a postdoc at Lawrence Livermore National Labs, always throughout this period working consistently on managing risks from toxic chemicals. And then he became chair at UC Riverside a few years ago. And in the path of publishing a lot on how to evaluate toxicity risks, he also took a year to be a prestigious Jefferson Science Fellow at the Department of State in Washington, D.C. And that was in 2004. But he's also guided the environmental toxicology program at UC Riverside for a while. Almost all the UC campuses have a environmental toxicology program, and we had a UC system-wide toxic substances research and teaching program that I also participated in until the system-wide program was discontinued. But we hope that on each campus we can keep the flame of environmental toxicology going through training programs, through visits such as this, to interact with faculty and students, and to engage incoming and new students into this really complex interaction between the basic science, the applied science, the policy issues that surround everyday products that we use. 80,000 chemicals is a lot, and I'm sure he's going to tell us how many of those we know something about to make important decisions. But really, it's my pleasure, and I thank you again for coming to this with us.
I probably should talk a little more about chemical legislation, regulation. Anyways, thanks, Billy. We got this opportunity of working together on this UC Toxics substance research and teaching program, and we were involved in a program involving green materials. Unfortunately, that ended a little prematurely, and so hopefully to keep able to do the work as we go on. Gave a little bit of an introduction, but for those who came in later, my research is really in the area of toxicology. And as I've gone through my career, I've become increasingly interested in risk assessment. And so what I'm trying to do is really talking more about kind of bigger issues in risk assessment. So I won't be talking about any of the actual research that my lab is doing per se, as far as bench research. But I will talk about some work at the end that I've been involved with the EPA. And really trying to understand how the science decisions are made at an agency sort of level. So, as I mentioned, I should probably give some background as an introduction to risk assessment. So I will go through this. So the first 5 or 6 slides relate kind of risk assessment initially, and then in the middle there's another 5 or 6 that will kind of give you background information. But generally, there are a couple of definitions that are important to be aware of. So that hazard is an ability of a substance to cause an adverse effect, kind of an innate ability of that substance. Risk is the probability that hazard or the effect will occur. Risk assessment is really characterizing the likelihood or probability that a risk will occur under specific exposure conditions, usually to a specific population. And these are considered to be kind of a scientific aspect of things. Risk management is more of a policy decision. And this is the process of evaluating alternative regulatory actions and selecting among them. So to illustrate this difference between hazard and risk, this is an idea I got from someone else I thought was actually fairly clever. But the idea of the hazard from the shark, if you're looking at an aquarium and people are there taking pictures and looking at this and observing, a shark is clearly a very dangerous animal species, but it poses essentially virtually no risk of the shark to these people themselves. So that would be hazard, the innate ability, the shark is a dangerous animal, but under these conditions pose very low risk. In contrast to this, where you have a surfer, you might relate, and I don't know if you can see it, but in this swell here, there's actually a shark underwater, and this is a very different, this is risk, and this is the real hazard, maybe in abstract. This is trying to figure out the real consequences. So generally there's thought to be 4 steps in risk assessment. This is really standard. This was developed by National Research Council, came out with a book in 1983 called the Red Book, Risk Assessment of the Federal Government. And it broke it down into 4 steps, generally considered to be used most of the time. So hazard identification is determination of the innate adverse toxic effects of an agent, then assessing the dose response. What's the relationship between dose and this health effect in humans? Then really what's assessing exposure, the measurement of the intensity, the frequency and duration of human exposure. And last, characterizing risk, estimating the incidence of health effects under various conditions of exposure in a given population. I use this in my teaching class all the time. I don't know if you can read it, but I like it because it graphically illustrates this sort of thing. So the 3 main steps of risk assessment is here in this middle box. You've got the hazard identification. Does the agent cause an adverse effect? The dose response assessment. What is the relationship between this dose and incidence? Exposure assessment. We talked about what exposures are currently experienced or anticipated in the future. And those are, now the information from each of these steps come from research. A lot of people are doing, some people here at UCLA, and elsewhere in my lab, where you look at lab and field observations. It could come from information even from suicide and sexual exposures. Dose response information, so funneling in. So the research funnels in to these categories. And then these 3, the hazard identification, dose response assessment, exposure assessment, are combined into characterizing the risk, coming up with this estimated incidence in a given population. Now the combination of this is risk management, and this is really what someone in an agency, an official, could be someone who's elected official or appointed, has to make a decision and say, what are the regulatory options? And you look and say, well, okay, evaluation of public health, economic, social, political, comparison of the risk, and finally you would make an agency decision. Now that's general framework that's used. So what I thought I'd do is talk about some ongoing developments that are happening currently in this area of hazard identification. And I'm going to focus on genotoxicity testing. This is the area which I've done a lot of research. And what's going on, kind of taking a bigger picture, discussion of what's happening at the moment. And literally, some of this is going on very much at the moment. So, talking about these genotoxicity tests, these are short-term in vitro and vivo tests designed to detect chemicals that can cause genetic damage. And agencies use this data in the absence of long-term animal studies to determine whether a chemical should be considered a possible carcinogen or not, or cause other types of terrible effects. And sometimes when you have long-term animal studies are available for the evaluation of carcinogenicity, this genetic toxicology data may be assisting in interpretation of these results. So the first part of what I'm talking about is really focused on this, and the second part, later on, we'll get into this area here. So I put this in context. So I mentioned beforehand, before you would take a pesticide to market, or in this case, a pharmaceutical to market, you have to do a series of testing. So you might do the test in the United States, and then you'd want to market that pharmaceutical in Japan. But the Japanese would say, well, we didn't quite agree with how you did that test. Therefore, you can't market your pharmaceutical in Japan. So you'd have to redo the test in Japan. And this could happen in Europe. So this ends up being what's called a trade barrier, where you can use scientific test requirements as trade barriers. This is very frustrating for industry. So they've gotten together, and it's called ICH, it's the International Conference on Harmonization, to try and come to an agreement of these are what all the major sorts of countries accept for testing requirements, and so that everyone will agree to accept them for the most part. So for looking at genetic damage, genotoxicity, screening for potential cancer risk, there are 3 tests that are required currently. One is a test for gene mutation in bacteria. I mentioned previously, Ames test is a common way of calling this. It's actually a series of tests, but very similar. The second one is an in vitro test. This is tests in cells, in culture, either looking at chromosomal damage, mammalian cells, or looking for mutations affecting a particular gene, thymine kinase gene. So these are in vitro tests. And the third one is an in vivo test, where essentially you look for chromosomal damage in the bone marrow or blood of rodents. And this is commonly done using a test called the micronucleus assay. So you dose the animals for a period of time, sacrifice them, harvest the blood or bone marrow, look for damage in the blood cells. So that's the sort of standard test. Once you get a positive result on this, it triggers usually additional tests. They're all negative. You say, okay, this is probably fine. If it's positive, then you want to say, well, under what conditions is it positive? And that can be illustrated. This is the test requirements for pesticides, very similar. Essentially the same 3 tests are required here, some variations. But what it shows here is once you get a positive result in these tests, then it triggers additional tests, looking at can the chemical interact with the DNA in the gonads? Okay? It can cause dominant lethal effects. It can cause heritable translocations, specific locus mutations. This is really focused on heritable mutations. But the idea here is that you have some in vitro tests and in vivo tests, and if they're positive, then you have a much more complicated, more involved in vivo test.
I'm kind of surprised that filling the first year doesn't knock out something from being marketed.
Well, it may. It's kind of a risk reward. You know, these become much more expensive, but if you think you can make a large amount of money and that there are reasons that these will be negative and this is due to some artifact, then you're willing to invest the money to do that. So the key thing is you have in vitro tests and some in vivo followed up with in vivo tests that are much more involved. As I mentioned earlier, in roughly 7 years ago, Europeans passed a cosmetic directive, the 7th Amendment. And this bans the marketing of cosmetic or personal care products that have been tested in animals. So that whole scheme just got lopped off 3/4 of it. And the ban on the testing of cosmetics went into effect in September of 2004. And a similar ban on the testing of ingredients took place in March 2009, almost 2 years ago. So all these sort of strategies for follow-up testing you can't do with cosmetics. So there's been a scramble to figure out how do you determine safety of cosmetics and personal care products in Europe. At one point, they went with 6 different in vitro tests. And the problem is every single product failed. So that was not sustainable. So they're still really wrestling. It's a big issue. How to test for the safety of these to assure that there's no problems when in fact you've lost the opportunity to do in vivo animal studies. So this is from one of the committees from the European community. It's their Committee on Consumer Products. This is their position from 2009. It basically said the current in vitro tests are very sensitive. Based on whether clearly negative results are seen in a appropriate in vitro test battery, mutagenic potential is excluded. At present, no validated replacement methods are available that allow the follow-up of positive results from standard in vitro assays without further animal experiments. Sort of their approach. So in many cases, it will not be possible to evaluate the mutagenic potential of cosmetic ingredients on a sound scientific basis. An important part of the toxicological evaluation of cosmetic ingredients cannot be accomplished. So that's one big thing that's going on in Europe. Concerns of animal welfare, not allowing in vivo tests. How do they go forward? They're really wrestling with this. Now the other legislation that I mentioned is called REACH. It stands for Restriction, Evaluation, Authorization, Registration, Evaluation, Authorization, and Restriction of Chemicals. And this went into law about 2 years ago. And it introduced registration and mandatory data requirements for new and what was estimated at the time approximately 30,000 chemicals manufactured or imported greater than 1 metric ton per year into the European Union. And the real key thing on this is they flipped the burden of proof. It transfers responsibility for risk assessment from the government to the manufacturers and importers. And this is having a huge impact on industry. It's not only in Europe, because if you want to market or import a product to Europe, you have to apply by REACH. Europe has 480 million citizens, huge market. So virtually many companies worldwide are trying to be compliant with REACH because of the opportunity for certainly to sell their products in Europe. So these are the testing data requirements brought up by REACH. And they vary depending upon the amount that's being manufactured or imported in Europe. If you have greater than 1 ton, there are certain test requirements. Greater than 10 tons, others 100 tons, 1,000 tons per year. And so if you look here, at the lowest test requirement, you'll need physical chemical data, boiling point, volatility, octanol water partition coefficient, things like this. There's some on environmental fate, one assay, ecotox data, maybe Daphne, I can't remember, it's a good chance. Probably algae, actually. And then there are about 6 that are related to mammalian toxicology. And as you go up with higher production values, you actually get pretty high test requirements. If you look at that, you're looking at essentially over 50 different tests that are required in order to market that. In a lot of cases, these have never been required before. It's a very costly proposition. So here, these are the tests related to toxicology. So greater than 1 ton per year. There's a test for skin irritation. 2 in vitro tests are required. 1 test for eye irritation in vitro. Skin sensitization, 1 test. Mutagenicity, this bacterial test is required. And then there's acute oral toxicity test. When you go up to 10 tons, it requires everything before it, and then these have been added to it. Okay. So now you get in vivo skin irritation, in vivo eye irritation, sort of thing. 2 more in vitro tests for mutagenicity, additional acute toxicity tests, repeated dose tests, reproductive developmental tests, etc. That goes on. Now you go up to 100 tons. Now you get additional, now the first in vivo test for mutagenicity, but you're having 90-day repeated dose toxicity tests, developmental studies, 1 in vivo, a 2-generation reproductive study, etc. So this ramps up. So initially when REACH came out, they thought it would affect about 30,000 chemicals. That was the number they were estimating. There were 30,000 chemicals that were manufactured or produced at greater than 1 metric ton per year. But when the last stages of REACH legislation, they thought, we really don't know how many are coming. Let's do a pre-registration phase so we can force people to work together to reduce animal usage, but work together to find out how many chemicals are coming. Well, when that pre-registration phase ended, there were 144,000 registrations that had been submitted. Now, some of these might be duplicates, but this was an article by Thomas Hartung, published in Nature about 2 years ago. In essence, because of duplications, their estimates are that the EU figure of 30,000 is too low. The worst case scenario is about 100,000. We need testing. Best case, about 68,000 chemicals. Individual chemicals need testing. So you saw that list of tests? You're looking at somewhere 60 to 100,000 chemicals are going to have to go through, as a minimum, these tests, but a lot of them, these other tests. Very costly, very time-consuming. Okay. Now, the other thing that they brought is the animals used. In the EU, in the original REACH legislation, they estimated it would require about 3 million animals to do the testing. And Hartung estimated that actually, in the worst case scenario, it would require 141 million animals to do the test. And the best case scenario is 54 million animals to do the testing that's required. The European Chemical Agency, which was established by REACH, their more recent estimate from last year is actually 9 million animals, kind of what they're thinking. So in Europe, you've got this big push for animal welfare to reduce testing on animals. They just passed a law that has very, very large animal usage. This is creating lots of challenges in Europe, difficulties. So as I said, what are the costs associated? Well, the vast majority of these costs really are associated with reproductive toxicity testing. Repeated dose testing has about 20% of the cost. And the cancer studies, the skin sensitization, et cetera. Because the cancer studies are only done for the most extreme cases, the number of animals used and costs are relatively, certainly much less than these. The animal usage, the vast majority is reproductive toxicity testing. But even if you're talking, okay, 10% here, let's say these genotoxicity tests, the follow-up tests, represent a fraction of that. You're still looking at hundreds of thousands of animals. So there's been a big focus in Europe of saying, okay, let's refocus on these short-term tests. How good are they? How sensitive are they? And this is really a figure from Mueller, based on data from David Kirkland's group. But these are different types of short-term in vitro tests. I mentioned the Ames test, which was done in Salmonella bacteria, the standard one. And it looks at two different aspects of this. One is called sensitivity, and one's called specificity. Okay? So sensitivity is a situation where you have 100 chemicals that are known to cause cancer in rodents. What percentage of those will be detected by your assay? So the Ames test, this is actually a little high, but close enough. 58, 59%. So the Ames test, this is this bacterial test in salmonella, will detect 58% of rodent carcinogens. Okay? So that's a sensitivity issue. Specificity is the opposite. When something's been tested and doesn't cause cancer, how often does it not cause mutations? So essentially it's saying this is specificity. So it's negative for causing cancer, and is it negative in your short-term test? And the Ames test does quite well in this way, it's almost 75%. So this is kind of an interesting combination. It's not as sensitive as others, but it's very basically specific. The other short-term tests is the mouse lymphoma assay, chromosomal aberrations in vitro, the microFuse test. So it's mainly in vitro. They tend to be more sensitive, they detect more rodent carcinogens, but their specificity drops off. They get a positive result when the thing doesn't cause cancer. And currently what you're doing is adding combinations of tests together, test batteries, shown before, and this shows combinations. So when you start doing combinations of test batteries, you pick up about 85 or 90% of the carcinogens, but almost 70% of your non-carcinogens are positive as well. So this is a problem because now if you have a positive result in a short-term test, it requires by REACH to do follow-up studies in animals. Okay. So what they're saying is this is a huge amount, this is a real problem, this lack of specificity. There's false positives. And there's been a huge focus in Europe on what can be done to try and reduce this. So if you look under REACH, these sorts of what false or misleading or irrelevant positives could lead to unnecessary testing of really tens to hundreds of thousands of animals, which is a very high priority. Also under REACH and the cosmetic laws, these could lead to the withdrawal or end of development of many beneficial or potentially beneficial agents. These come with consequences. So there's going to be major economic consequences one way or the other of these. So that, just to kind of overview what we've been doing and looking at, this is going on actively. Okay? So they're exploring the use of more representative cell lines. We work with better cell lines that aren't as sensitive. They want to lower the maximum cytotoxicity limits for these in vitro mammalian cell tests. The in vitro mammalian cell assays are the ones that they have the most problems with. Can you reduce the maximum test concentrations for in vitro mammalian cell tests? tell you how tiny this is. Tomorrow, there's an expert group meeting in Paris called for OECD, which stands for the Organization for Economic Cooperation and Development. Again, this is 45 countries or something that work together to try and agree upon test guidelines that they'll all accept. And this is currently a matter of debate. Before I came here this morning, I sent out an email to one of the people who's going to be there. She'd asked me for my advice.
Sorry, I don't really understand lowering the toxicity limits, meaning to improve specificity.
Yeah, essentially what happens is there's a belief that as you get to really highly toxic, cytotoxic levels, you get lots of damage that occurs. I mean, fundamentally, if you think of it as a cell dies, as the cell starts to die, it starts releasing nucleases, which start degrading DNA. So if you catch it that period and you're looking for DNA, the integrity of DNA, you're going to say, oh, it's causing DNA damage. The damage may not be a direct sort of due to reactivity of the chemical. It may simply be a secondary effect in toxicity. So rather than going to testing at really high levels of cytotoxicity, you bring those down, it's believed you'll eliminate some of these sort of artifactual results. And you may not know this, but there have been long debates about what that level should be. I mean, literally, it's went on for a couple of years on some of the assays I've been involved in. I mean, I was involved in this. And right now, this is one of the big focuses, what's the maximum test concentration? When you say I've tested too much, we're done. That's essentially what I say. The other point is to modify the standard test battery to replace the in vitro mammalian cell assays with a second in vivo test. Or there's a whole big thing of exploring new assays and approaches. So EPA, FDA, National Toxicology Program are trying to come up with what's called Tox 21, toxicology in the 21st century. Can we replace the existing tests with better tests using genomics, proteomics, screening assays, et cetera? And that's going on. And then there's a refining interpretation of test results, which may help out. There are a lot of people that spend quite a bit of time on this. So that I talked about those ICH genotoxicity test guidelines. What they were trying to do, they finalized. The pharmaceutical industry all got together, some FDA, and essentially agreed. That was kind of an interesting story. So they had talked about this, and they agreed to what they thought was this maximum test concentration, and they could eliminate the in vitro mammalian cell assays. We all got together, and they were going to have the final signatures of all. There was a meeting in Japan. A representative from the FDA was there. He was going to sign it to agree to this. He got a phone call from his boss ordering him not to sign that document. That there had been enough pushback from other scientists in the FDA that didn't agree with that they wanted more time to discuss it. And so it was accepted by all the other regulatory bodies, authoritative bodies around the world, but the US FDA did not agree to it. And they convened an expert panel in January of 2010 to advise the FDA. I was actually the chair of that panel. But the final decision has still not been made, whether they will accept it or not. So that's kind of the status on this. And what they're proposing to do is to keep the status quo in this option, or the use of gene material assay for gene mutation bacteria. And they would turn around and would have the measurement of chromosomal damage in animals, and then take a second measurement of genotoxicity in vivo is the proposed replacement. So whether FDA will buy into that or not is still a question. But,
are you at liberty to say what the core of the FDA scientist's objection is to the?
Sure. Well, it's kind of interesting. Yeah, basically, the concern with the objections from FDA scientists are twofold, really. One is that, well, let me put it in context and I'll explain the objections. The Center for Drugs is really the key one involved. It's called CDER. For the Center for Drugs, they do these short-term tests in vitro in these short-term genotoxicity assays. And then they, in 90% of the cases, they require a follow-up animal, 2-year animal bioassay for cancer. So they require a cancer bioassay as a follow-up. Okay? So they will get eventually the cancer bioassay results. So from an expert panel point of view that we were on, it says, under these conditions, it makes sense to skip this one test because you're going to get the cancer data anyway. Well, the FDA scientists, there's 2 groups of them. One problem that they're concerned about is those animal cancer results are not available until they've already gone into phase 1 and phase 2 clinical trials. So you'll be testing things in humans without knowledge of potential genotoxicity. And certainly your most sensitive genotoxicity tests you don't need. The flip side of this is that there are other centers within the FDA, those that deal with food additives, those that deal with veterinary medical products, et cetera. And they can't, well, CDER, drugs can require a test to be done as part of the package. Those other groups can't require things. They only can get what's given to them. So for food additives, what's happening is you're eliminating what they think is one of the most powerful clues, is that if there's a problem, they should pursue it more. So that's why they oppose it. So it's a big, actually it's caused quite a split within the FDA, quite acrimonious. And you've got policymakers that really don't understand the issues. They're hearing from one group totally supports this, and the rest of the world tends to support it. But then they have this other group of their scientists that vehemently object it. So they have to make a decision, and really, this is not a position you want to be as a regulator. It cause a huge rift. Would that help?
Yeah, absolutely.
So that's what's going on with FDA. So that was kind of a hazard identification. Let me talk a little bit about dose response assessment and harmonization of cancer and non-cancer approaches. So in standard sort of risk assessment, what you can look at, it's called in the 1970s, it's called essentially a parallelogram approach by Fritz Soltys. But essentially, if you're looking at what happens in rodents going from high dose to low dose, you can figure out what your dose response curve is. You might assume that the same thing happens in humans going from high dose to low dose. If these are comparable and the responses are comparable. That's sort of the basics that's used. And there are 2 approaches. But what you're really interested in is what's happening in this really very low dose region down here, and how to make determinations. And there are 2 approaches that are used for this. One is you assume, as shown here, you've got a dose response, you draw a line, and this goes down and intersects a 0 point. You have actually a threshold. And so if you can identify what that threshold is, by definition, anything below that would be safe, because it's below a threshold. And above that, there's a risk. The problem is we're working with animals most of the time, and we don't know how humans compare with those animals for most chemicals, so you want to build in some sort of uncertainty factor to deal with uncertainty. And so usually you deal not only uncertainty from animals to humans, but uncertainty within humans. The standard way is to use uncertainty factors, tenfold for human variability, tenfold from extrapolation from animals to humans, then depending upon data quality and some other things, you might have other uncertainty factors. So that assumes there's a threshold. Yeah. Very commonly done. This is the standard thing that's done for non-cancer agents. Things that don't cause cancer, this is the risk assessment approach that's used. Now, for things that cause cancer, usually a different approach is used, and that's, you'll have a series of studies. Maybe you've got 3 bioassays that have been done in mice and rats, and a second study in rats, and you look for which one caused cancer. And the most sensitive sex, species, and endpoint, and that may give you a dose response curve here. Now, the observable range, usually you can't see anything below about 10% for statistical reasons. So at this point, an extrapolation is made. You have to extrapolate to low dose region. You're trying to figure out what's safe. And generally what's considered a safe dose is one that affects 1 in a million individuals. Called a virtually safe dose. And that's shown here. So you have to extrapolate. And there's different extrapolations to be done. You can assume it has a threshold that drops off very rapidly. So there's no risk at low dose. You can assume there's some sort of sublinear effect or a linear effect. You can actually assume there's a superlinear effect as well. Less common. So this extrapolates to the low dose region. So the current EPA approach is to, you look at your actual dose response, and here would be modeling that dose response. But in reality, if you start here at a 10% effect level, you think half of your individuals have a higher risk and half of the individuals have a lower risk, right? So they want to be conservative and protect most of the population. So rather than working from this 10% line, they actually work off of the lower confidence limit on the dose which it crosses, and that's called this LED10. The lower confidence limit, the effective dose affects 10% of the animals. From there, they do a linear extrapolation down to 0, extrapolate to very low dose. It's kind of the current approach that's used. So again, this is usually used for carcinogens. Now there's been some refinement. So it's not all carcinogens, it's really mutagenic carcinogens. So it's more or less used for this. So as I said, there's two approaches that are used. For non-cancer agents, seem to have a threshold. You derive a reference dose, be a safe dose. EPA calls this a reference dose. World Health Organization calls this an acceptable daily intake. ATSTR calls this a minimal risk level. There's all sorts of variations for the same thing. For mutagenic cancer-causing agents, it's assumed that there's no threshold, that risk is present at very low doses. A mathematical model is used to extrapolate. And usually 1 in a million risk is kind of what is the benchmark. And so you put this together to try and estimate risk. As I was saying, that the breakdown initially was carcinogen, linear extrapolation, non-carcinogen, non-linear extrapolation. More recently, we've had mutagenic carcinogen, linear extrapolation, non-mutagenic carcinogen, threshold. Industry wanted the threshold. Makes life a lot easier. It's much, much cheaper if you can assume there's no risk below a certain thing, you can forget about it. Okay? So there's a big push over the last 10 years to try and harmonize. They didn't like this dichotomy between mutagenic, carcinogenic, and non-carcinogenic. So they proposed to harmonize based on a threshold. The threshold should be used for everything. Well, the National Academy of Sciences gets together, the National Research Council, and they convened an expert group on risk assessment. And the nature of the people in this group, they basically said, yeah, we should harmonize. We should make these the same, but we should harmonize on a linear approach rather than the threshold. This has a lot of weight. Okay? This came out in 2009. Industry is very upset about this. I mean, there are many different working groups trying to figure out how to change this recommendation. It came down to Warren Zeiss was one of the key people, Cal EPA, Gary Ginsberg, the state of Connecticut, was another key person. And there's some pretty good arguments you can make for using linear extrapolation. Now the other thing on this is usually you work in animal data, and it doesn't take into account heterogeneous populations. So you work with rats, you work with a particular strain, almost always white rat. Okay? So these are really inbred and they're very homogeneous. The human populations aren't homogeneous at all. So even when you see, and this is kind of theoretical, but it makes sense and probably correct. So in animal models, you'll see this sort of sigmoidal, nonlinear, sort of sublinear dose response curve frequently. However, you don't see that very often in human studies. And the reason is thought to be the following. In a genetically homogeneous population, you may have a sort of nonlinear type of response that's seen. However, when you start working with heterogeneous populations, where there may be genetic susceptibility, what's going to happen is you'll have your regular population B, but there'll be a sensitive subpopulation that will blip up earlier. And when you start getting a heterogeneous population with all sorts of multiple genes involved and environmental lifestyle factors, what happens is you get lots of bumps, and this appears to be more or less linear. So that's why it's thought that in human studies, usually you see linear types of responses, where in the animal studies, they can be very much nonlinear. Now the other factors, so we've got the sort of epidemiology where you get into this one approach. The animal bio is another approach. The third approach on this is looking at mode of action information. So if you understand how these chemicals work, it ought to allow you to make some decisions and inform this decision-making process. So I'll talk a little bit about these mode of action. I'm going to get you guys thinking and giving me feedback here shortly. Okay, so In the Cancer Risk Assessment Guidelines that came out in 2005, essentially said if an agent acts through a mutagenic mode of action, this will affect how one makes decisions about the shape of the dose response curve in the low dose region. At the same time, there was supplemental guidance for assessing susceptibility early life exposure that came out for carcinogens. And this determines, if it's mutagenic, it determines whether you add additional, essentially safety factors, an age-dependent adjustment factor to protect against early life susceptibility. So whether something's mutagenic or not actually becomes very important from a regulatory point of view. And very simplistically, you can say, if it has a mutagenic mode of action, you assume linear extrapolation. If it doesn't, then it's a nonlinear threshold approach. It's actually not entirely correct, but it's close enough for illustration. So the problem right now, and this is what I've been involved with the EPA, is the basis for determining whether a carcinogen acts for a mutagenic mode of action is not firmly established. Okay, what weight should be given to various test results? What kinds and how much evidence is necessary to make that conclusion? This is currently the focus of an EPA agency-wide task force. They've been working on it for about 4 years. They can't come to an agreement. They came up with a proposal. They went out for expert review. They got shot down. They're revising it. And this is what I've been involved in with the EPA, is taking, rather than looking at theoretically what happens, what's happening in practice. So I'm going to give you a couple of examples here, and this is kind of an idea of scientific decision making. This is a small molecule called ethylene oxide. Its common use is industrial intermediate. It's used for sterilizing agents. Those of us have been in the field for a long time have seen it. Anyway, this is an epoxide that's basically reacts with DNA, so it binds DNA both in vitro and in vivo. It's mutagenic in bacteria, it causes chromosomal damage. It's mutagenic in vivo, both in non-target and target organs. You can actually pick up in animals that have been treated with ethylene oxide. They develop cancer. You can go to those the tumors. You can sequence genes that are involved, carcinogenesis, P53 and RAS. You can actually see increasing mutations in those genes, kind of unique sort of patterns. It causes all sorts of effects in humans. Similar things are seen in basically similar agents cause mutations. So one of the authoritative bodies that determines whether something's carcinogen is called the International Agency for Research on Cancer. Let me give you a little trivia. This is an international body, World Health Organization. You know which body does this within the state of California? Determines whether a chemical is known to the state of California as causing cancer. A body called the Carcinogen Identification Committee. It's formed under Proposition 65. So you go to gas pumps and you see that little sign that says this establishment is known to use agents that cause cancer. Anyway, that's the one that does it for California. At the federal government level, there's another agency, it's part of the National Toxicology Program, that makes a determination on that as well. So different authoritative bodies, but the International Agency for Research on Cancer is considered to be very well respected authoritative body. So they consider this actually a genotoxic or mutagenic mode of action. I think everyone agrees it's positive in all these different tests. Let me pick another one that's a little different. Chloroprene, chemical structure shown here. This is used in making synthetic rubber. Okay? Sorts of things like the hoses in your car that connect between the radiator and engine. That's the sort of thing, hard rubbers. The question is that it's been tested in animals, and it is really positive. It causes tumors in something like 8 tissues in rats and 6 or 7 in the mouse. I mean, this is not a borderline carcinogen. This is a screaming positive. Okay? So now you're regulator, you have to make a decision, does this act through a mutagenic mode of action? When you assume a threshold, or we have to extrapolate? So here's your data. It does bind to DNA in vitro with metabolic activation, but you have no information in vivo. Okay? It's positive for mutations in some bacterial studies, but it's pretty iffy. A lot of them are negative. Kind of a strange mix. been tested in one study of mammalian cells in vitro for mutagenicity, it's negative. It's largely negative for causing chromosomal damage, DNA damage in vitro and in vivo. Okay. It's negative for mutations in one study in vivo. It has mixed results in some Drosophila studies. So, however, if you look at cancer-related genes in these tumors, multiple tumor sites, there's kind of unique spectrum or pattern of mutations. A fingerprint is seen. It's quite unusual. And that fingerprint in types of tumors are actually quite similar to that's been seen with 1,3-butadiene, isoprene, and vinyl chloride. So IARC considers this a 2B, essentially probable human carcinogen. Oh, actually, IARC it's possible human carcinogen. So you're a regulator. You've now graduated, you've got a job with the EPA, you're working the IRIS program. IRIS is their risk assessment program. Sorry. So what do you call this? This acts through a mutagenic mode of action or not? Venturing guesses. So what are the pros? Well, you've got a little bit of data here. It does bind to DNA in vitro, but you can force almost anything binding DNA in vitro if you play your conditions right. Negative, almost totally negative in vivo. You got some in vitro stuff, but your in vivo stuff's pretty much negative. Yes?
So how strongly is the mutation seen in cancer-related genes? How strongly correlated is that with something being cancer? Is that like a very important?
Well, that's actually a very good point.
Like you said that
Yeah.
it had a very specific fingerprint.
Well, there's two arguments on this, okay? Since cancer is a genetic disease, even when something doesn't act through a mutagenic mode of action, because of cancer tumor, eventually you're going to have gene mutations occurring in that tumor. So the fact that you have mutations by themselves may not be convincing, but what is convincing in this case is the frequency and the type of mutations. The type of mutations are very similar to what's seen with these other agents that are known. So you see the same sort of base pair substitutions or frame shift mutations. And so it gives you kind of what's kind of like, you can think of this as a fingerprint. So that is actually, for me, is a very influential. This is very heavily influential. Good point. Any other thoughts? Now, if you're in industry, you're going to want this to be non-mutagenic mode of action because it could save you a ton of work, a lot of money, et cetera. And you're working in a sort of range of ambiguity. But EPA didn't weigh in on this one. And they determined that the mode of action supported, the evidence supported mutagenic mode of action. And I can see why they come up with that. Let me give you another one for dioxane. Okay. Common solvent.
So can we go back to that before we, I will forget. Sorry.
Sure.
So
that might be to my benefit.
Yeah. If I'm someone in the industry, why can't I request for additional information, additional studies? Meanwhile, we keep the product on the market. So, for example, negative publications in one study, and then mixed results of Drosophila. You say, why don't we clarify the uncertainty?
Oh, they try to do this all the time.
I know.
Oh, I mean,
but this judgment by IRIS would be called premature by somebody who is a strong advocate of industry.
well, I should say it's not always industry.
Yeah.
Okay.
Well, it would be.
So naphthalene. Okay. Naphthalene is a simple sort of aromatic benzene ring that's fused.
Mothballs.
Yeah. Mothballs. Naphthalene was considered to be, it was known as toxicity to mouse lung. But wasn't really concerned about cancer until there was an NTP bioassay that was done. And it was basically suggested for cancer in mouse lung, but very strong for cancers in nasal cavity of rats. So this is moving its way. EPA wants to regulate it. Halt. Shut down, well, this is during the Bush administration, and they generally didn't like things to go forward. I mean, they're opposed to regulations and regulate. Well, who's the big problem? Well, the Department of Defense has all sorts of contaminated groundwater sites. They have naphthalene in it. they're on the hook for billions of dollars. I mean, we're talking billions of dollars if EPA's sort of safety levels go through. So they stop it and say, what additional studies do we need? We better wait for those studies. It goes into a delaying process because they don't have to spend the money while it's being delayed. And you can debate this linear, nonlinear, mutagenic, non-mutagenic to your advantage. So if it's to your advantage economically to keep something on the market without having to pay, you'll be arguing that point of view. And that's part of the big forces that go on. So anyway, 1,4-dioxane, this is pretty well negative. Negative for DNA binding, non-mutagenic. Mixed results largely negative for chromosome damage in vitro and in vivo. No information on mutagenicity in vivo. However, it's been positive in several studies for chromosome damage in the target organ, in this case the liver. One of those studies was done by my laboratory. So I have some interest. No information, mutations in cancer-related genes, no information on genotoxicity in humans, no information on similar chemicals, not evaluated by IARC. What decision is made?
What's the chemical used for?
It's a general solvent.
Okay, so there would be possible exposure to humans.
Yeah, there's actually pretty high exposure to humans. It's a commonly used solvent. So I should tell you a little trivia. I'm doing a poster with colleagues in EPA on some of this stuff, this mutagenic mode of action. As I left my car, I got a voice message. I called up one of my colleagues and said, the poster's been approved, but they need you to change the conclusion on this chemical. So this is the way I interpret what they said. Okay. They said they think it's likely carcinogen with an unknown mode of action. The evidence indicated that it's either non-genotoxic or weakly genotoxic. They didn't like that conclusion.
Unknown.
So this was, I'll have to look at it when I get home, but I kind of said, well, I think whatever change you want, doesn't matter to me. I mean, you get into this how you want to word things on the edges. Yes?
When you say genotoxic, are you also looking at epigenetic differences in the chromosomes? So acetylation, methylation, that might alter key genes?
That's actually a very good point. Right now, the regulatory strategies don't know how to deal with epigenetic changes. And there are almost no good short-term tests for epigenetic changes and even how to interpret those. So it's clearly going to happen on the horizon. It's an area for promising research, but it's not. Nothing's done at this point. People recognize they must be happening, or clearly happening, but what chemicals do it? I mean, the one that's probably the poster child for this is 5-azacitidine, which IARC considers a probable human carcinogen. That's the only one. Anyway, let me. I had a whole series of these, but I think I'll go to questions. Let me just summarize here. Well, these are some of the other factors. This is stuff I've been working on. Is trying to identify, okay, you got these short-term test results, but what are the other factors that weigh in making these determinations? Well, one is understanding differences between in vitro and in vivo metabolism. That becomes really critical. In some cases, you can have 2-nitrotoluene. All your in vitro data is negative. Most of your in vivo data is negative, but it is positive consistently for what's called the unscheduled DNA synthesis, although it does bind to DNA as well. So, but realizing that, you can explain away the in vitro data because the metabolism in vivo is really quite complicated. Part of the metabolism takes place in the intestine by microorganisms, bacterial microflora in the intestines, and that's critical. You won't find that in vitro. Importance of uptake and its impact on in vivo genotoxicity results. The difference between chromium-3 and chromium-6 is very likely uptake related. Structural similarity to mutagenic carcinogens, distinctive mutations in cancer-related genes play a role. Impact of toxicity or high-dose effects. 1,4-dioxane, I should have told you, the reason they went with it is the positive results were seen at really high doses. And so they kind of said, we think this is secondary to toxicity, so we're going to ignore those. So my data got swept away. It's like, well, it's okay. They have to do that. Origin of oxidative damage, evidence for alternative modes of action. Let me just conclude quickly. Well, I'll skip that one. Generally, New regulations, societal concerns are increasing use of genotoxicity tests and are bringing more scrutiny to the accuracy of current methods. There are new initiatives such as POX21, collaborations underway, but they're likely to have the same problems in many respects that occur with current assays. So given their extensive and established use and regulatory acceptance, many of the current assays will likely be used for the foreseeable future. So one thing you have to figure out what to do with it, and refining our interpretation, what they're doing, the Europeans are doing, is actually quite, I think, valuable to find can we make these tests better. As far as mode of action, determination whether the chemical causes cancer or immunogenic mode of action should be based on a thorough understanding of the chemical's metabolism and toxic effects, and those of similar acting agents. Decisions should not be simply based on superficial counting of the number of positive and negative short-term test results, which is often done. And the last one is this, I started off with this. This is a sculpture by Stuart Johnson called The Awakening, which is this reaching up from. Hopefully reach is coming out and will actually lead to a better future rather than a worse future. Anyway, thanks for your time.
I think we have time for questions. Yes, sir. So I'll ask one. Well, so one of the concepts we talked about, biological possibilities in causality, that is.
Okay.
So when, I think one of the chemicals that you showed, no evidence of DNA binding,
Okay.
but then chromosomal damage. And so the uninitiated, these are probably mutually exclusive, but apparently not. So how would such results be interpreted in this context? But maybe there is a mechanism that we're just not.
Okay. That's a very good point. The vast majority of chemical carcinogens bind covalently to DNA. Not all of them. There are things like intercalating agents that don't bind covalently, but cause mutations. You can also get something that will essentially cause oxidative damage. So it doesn't bind covalently, but it causes damage to reactive oxygen species that bind to DNA. You can also get chemicals that interfere with enzymes such as topoisomerase 2, which will inhibit topoisomerase 2 and cause DNA breakage that will not result in DNA binding. But for the most part, that particular example was used as one in which that was part of the argument for this is probably not working for a genotoxic mechanism. There are others, though. I mean, I was asked specifically, could you come up with an idea of they think this is working through causing mutations, but they can't detect any DNA adducts. Why might that be the case? Well, some of these adducts can be unstable and result in abasic sites. Mike, it's your question.
Yeah, there are also compounds that are, I don't know what you call them, co-carcinogens, secondary carcinogens, that operate through more on the promotion side of cancer as opposed to the initiation side of cancer. And is there any plan to integrate that into the risk assessment process?
Not that I'm aware of. The risk assessment process, one of the real weaknesses in the current risk assessment process is it works one chemical at a time. But we're all exposed to multiple chemicals and they may cooperate in their interaction. So this is kind of a synergistic or potentiation. And people talk about it, but it's so difficult to try and figure out how to actually manage it. Because you can think of all these, you've got a dose response, and you can think of a second chemical, and it may have effects at a totally different series of doses. So you have to test every dose with this, with every possible combination of that one. It gets sort of a matrix or array. Numbers of possibilities get really large. I'm sure you've dealt with this. I mean, from an experimentalist point of view, I've dealt with it as well. And usually try to take the easiest way possible, one chemical at a time.
So there are many, is IRIS support, it's a database that EPA is doing a lot of work to put together and support with strong evidence. Is it also supposed to be consulted by the general public? Your second to last slide about society and science, because I know there are databases you can go to them online that are, I don't know, it's non-profit organizations, type in your chemical, should I buy this product or not that product? So I don't know how good the science behind those kinds of databases, and if EPA is not going to be the place to go for everybody, then it's a really difficult situation for consumers to know who to believe.
Well, the IRIS database, which is Integrated Risk Information System database, produced by EPA, is really considered to be kind of the agency-wide determination. Now, they won't, sometimes they'll put up things with pesticides or others. Other offices may weigh in specifically. But the idea is that's supposed to be the general overview of what the EPA and how they evaluate it. And they're putting a lot of work into it. I mean, and it's, in the past, what the IRIS database really just had kind of the, if you think of this, the abstract or the summary, that's all they would post online is the summary, and you wouldn't see all the stuff behind the scenes. Now they're putting toxicological reviews that support the conclusions being made. And these are beasts. I mean, some of these are, the usual ones, 100 pages long, but typically several hundred pages long. I mean, you get things like TCDD, they're thousands of pages long, documentation. And usually the more documentation, the more controversial, the longer it takes. And the process is delayed oftentimes. But that's considered a kind of the agency-wide decision. But then again, ATSCR has their opinions, FDA has their opinions differently. Europeans will do things differently. Try and look at things and compare, make your own determination.
How do you propose that non-genotoxic carcinogens be handled in your risk assessment?
Non-genotoxic carcinogens. My approach on this is, I'm fairly pragmatic in how I approach things. And I mean, I think you look at the same thing. You want dose-response information. You understand the mechanism, but I'm open to sort of using the nonlinear, sublinear approach for non-genotoxic carcinogens. It just needs to be established sufficiently that you have confidence that's how they're actually working. One of the interesting things with the class called peroxisome proliferating agonists, PPAR alpha. Then this is a mechanism of action for a lot of liver carcinogens, and it's established. Well, unfortunately, with the knockout mouse, the mice have knockouts in this receptor, still get the cancer. So what may be argued is this mechanism everyone's been jumping on the bandwagon may actually not be correct. So you want to have at least enough assurity that you're making a decision that it's actually firmly based in scientific knowledge. But I'm open. I mean, I'm of the opinion that if you take a standard approach and use uncertainty factors appropriately, it's probably adequately protective of human health. But you can also make very good arguments for linear extrapolation approaches for many of these agents as well.
And how about very low dose radiation, where we actually see an adaptive response? So it actually goes below the 0 point. There's less chance of getting cancer, according to the models of this.
Yeah, there is a movement that believes that some argue that very low dose may be beneficial because there's an adaptive response. And there's in vitro studies in radiation, you can see this. In the vivo studies in humans, I don't believe has. And the major, like the Beer Commission on this, has kind of concluded that from a public health point of view, it's probably safer to use a linear extrapolation than to go with some of the hormesis and other approaches. Unless you have really convincing evidence that's the case. You may have some data that shows this adaptive response.
Also, in terms of the tests they're trying to modify to get some of the specificity issues addressed, have they tried looking at human cells, which tend to be resistant to chromosome damage, more so than rodent cells? Most of the mouse and other rodent cells tend to be highly sensitive to chromosome aberrations and chromosome damage compared to humans.
Yeah, you're right on the money. One of the problems with the rodent cell lines, for those of you who may not know, there's a critical cancer-related gene called P53, which is a tumor suppressor gene. Essentially, it stops the cell cycle to allow time for DNA repair to take place. And if it's too much damage, it uses apoptosis, programs cell death. Almost all of the rodent cell lines lack functional P53 activity. And so that those cells that ordinarily would die off don't die, and they go on and you pick up the chromosomal aberrations. Whereas the human cell lines are almost always P53 competent. So there's a big shift to the human cell lines mainly because of P53 status. So that's one of the things that's happening right now, is trying to shift away from the B79 or the CHO cells to go to these other human cell lines like TK6, in which they appear to be more resistant to certain chromosomal damage. That's thought to be the mechanism.
Thank you, and we can continue.